I had never been overweight. I'd always been active. I'd always been the high achiever, go getter, do everything for everyone else. And now I was like living as a shadow of the person I was. My oncologist, although brilliant, I said to him, like, all of this. And he was like, yeah, that's the price you pay to be cancer free. And my friends and family were like, look, just give yourself grace, just give yourself time. So I
Yeah.
did. I waited 8 months. I remember I waited the entire like summer, like, into the fall, into the winter, and I still felt exactly the same. I still felt like a shadow version of myself. And that's when something inside of me like snapped. And I was like, I refuse to live a fraction of the life I used to.
Hi, I'm Bisma, and you're listening to The Other C Word, a podcast about all things cancer from a stage 4 breast cancer warrior. We cover health and wellness, mind, body, and soul. Plan to leave each episode with hopefully some new insights and inspiration. Let's get into this week's episode. Today's guest is Dr. Amy Morris. She's a cancer recovery coach who founded the Cancer Freedom Program. She is extremely passionate about helping women regain their health, confidence, and vitality after cancer treatment. Dr. Amy herself is a stage 3 cancer survivor and has been cancer free now for 7 years and counting. Her program has helped countless women break free from the lingering effects of cancer treatment and also helping them to reduce their risk of recurrence and really allowing them to thrive post-cancer. So today we'll discuss her cancer experience and what led her to create the Cancer Freedom Program and the strategies that she uses to help women truly live again after cancer. Dr. Amy, thank you so much for being here. Welcome to the pod.
Thanks for having me.
Thank you. So maybe we can start with your personal story. What was your life like before you yourself got diagnosed with cancer? And then maybe you can walk us through, your actual diagnosis story, if that's okay.
Yes, of course. So I have to go back then to 2016. And in 2016, like, gosh, I was really like the healthiest I'd ever been. You know, I was working out. I had a job I loved. I worked in cancer care. So I helped women through their cancer treatment, with their treatment side effects, help them get through their chemo cycles, surgery, radiation. Um, I lived like a great life. I had no family history of cancer. I had just gotten married. We had like this beautiful fall wedding. We went on a trip to Italy and Greece for our honeymoon. And we did what everyone should do in Italy and Greece. We ate we ate pizza and we drank wine and we had gelato. And when I came home, I had obviously gained a little bit of weight, but like 5 pounds or
Okay.
so, not much.
Right.
And I noticed, like, even as I got back to my regular routine, I wasn't like losing the weight and I continued to gain.
Okay.
But the most alarming side effect, the thing that really drove me to like take action, was I had heartburn.
Okay.
I had heartburn all the time. I had heartburn. I couldn't eat anything. I had Tums in my desk, and like I was young and I had never had heartburn before. So I
Yeah.
just went to my GP thinking like, okay, I've got like an ulcer or like
Sure.
something is happening here. And she did a physical exam and then she said, well, let's just send you for some like basic blood work. And then let's also do an ultrasound of your abdomen.
Okay.
She's like, look, things grow on women's ovaries, right? Like, I think if you never have problems with your ovaries, you think like nothing happens, but women get cysts and fibroids and like things happen. So let's just do an ultrasound of your abdomen and see what's going on.
Okay.
And I remember standing at my kitchen counter and it was 5 p.m. on a Friday. And my doctor's number came up on my phone. And I answered it and she said, look, I'm surprised you didn't notice anything. You have a tumor on your ovary the size of a football.
Oh my
My
gosh.
tumor was 21 centimeters by 10 centimeters. So that's like the size of a football.
That's crazy.
And she said, like, look, sometimes like women get large tumors on their ovaries and it doesn't necessarily mean that it's cancer. Okay. So I'm going to send you to a specialist. He's going to look at you. then we'll just see. But there's a high percentage that's not cancer. So like don't freak out,
Mhm.
totally freaked out.
Of course you're
Okay.
gonna freak out,
Yeah.
yeah.
Okay. My entire world like basically dropped out from underneath me.
Yeah.
This then became the only thing I was focused on. So after following up specialist scans, I had this crusty old gynecologist
Mhm.
that had a reputation for having terrible bedside manner. Okay.
Okay, lovely.
This guy saved my life. Okay. I went into his clinic and he was like, look, tomorrow, meet me at the hospital. You don't have an appointment for a CT scan, but I'm going to get you a CT scan. Okay. Meet me in the emergency room. Met him in the emergency room. That old crusty guy advocated for me like none other.
Yeah.
We spent the morning in the emergency room in a room. He finally came back in and he sat down on the set bed beside me and he said, I'm sorry, kiddo, you have cancer.
Wow.
And I was diagnosed with stage 3 ovarian cancer. And he said, but look, I've trained the best surgeon in the country, and he's in this city. And so he's like, I'm going to refer you on to him.
Mhm.
And, like, look, when I was first diagnosed, I was like, I'm going to find the best experts because, like,
Right.
this is my life on the line.
Yeah,
And if I don't have my health and my life, I have nothing. Like the house, the car, the job, the vacations, nothing else matters if I don't have this.
totally.
So all of my time, efforts, and resources are going into this now. And he was right. He is like my surgeon was the best in the country. So I underwent a massive surgery, like the largest incision you could have over your abdomen,
Right.
removed my tumor, one of my ovaries, 33 staples to put me back together. Then I started undergoing chemo. I did intensive rounds of chemo, and then I was cancer free. Okay. And so I mistakenly, even though I have an extensive research and clinical background in cancer care, I mistakenly thought when chemo ends, your cancer is over.
Right.
And this is not true.
Right.
I had extreme exhaustion. I was drenched in hot flashes. I had gained 20 pounds during my treatment. I had never been overweight. I'd always been active. I'd always been the high achiever, go getter, do everything for everyone else. And now I was like living as a shadow of the person I was.
Right.
And my oncologist, although brilliant, I said to him, like, all of this. And he was like, yeah, that's how it is. Like, that's the price you pay to be cancer free. Right.
Right.
And my friends and family were like, look, just give yourself grace, just give yourself time. So I
Yeah.
did. I waited 8 months. I remember I waited the entire like summer, like into the fall, into the winter, and I still felt exactly the same. I still felt like a shadow version of myself.
Right.
And that's when something inside of me like snapped. And I was like, I refuse to live a fraction of the life I used to.
Right.
And so I was like, look, I'm a cancer researcher. I'm a clinician. I can figure this out. So I threw myself into research. It's now been almost almost 8 years. It's been over 7 years since I've been diagnosed. And now I can confidently say I have found like the true strategy that will help women recover as quickly as possible from their cancer treatment.
That's amazing. I think what's really unfortunate is like it sounds like you were generally feeling really good before this cancer, right? It's like minus you're saying the heartburn, but like you were active, you're young, you're healthy. And then it's like post cancer, you're this, shell of a version of yourself and you feel worse than you ever did before. So,
Exactly. It's
yeah.
a hard reality, I think, for a lot of cancer survivors to grasp.
Yeah.
Like, if you have breast cancer, for example, but you've no symptoms,
Right.
right? You're like, uh, maybe even you had a routine mammogram, you didn't even feel a lump,
Right.
right?
Right.
It's like nothing, and then you go from that, and in exchange for your life,
Right.
you need to give up all these things. It's like you're Ariel from The Little Mermaid, right? Selling your voice.
Totally. I mean, so my story is a little bit similar in the sense like I felt completely fine. I, was healthy, young, all of a sudden got excruciating back pain. Like that was the first indication that something was off. And I thought it was some sort of like slip disc or pinched nerve. But it was just like progressively getting worse and worse. And I had to go to the emergency room, and they really were, dismissive because I was pregnant. They said, we don't recommend doing a scan. We don't think we should give you much pain medicine. It's not good for your pregnancy, for the baby. And it wasn't until I advocated for myself and pushed for a scan that a doctor walked in and said, "You have metastatic cancer." And it's all over your spine, it's all over your sternum, your pelvic, it's literally just spread everywhere. And through a biopsy and testing, we found out that it's a hormone driven cancer. And so because I was pregnant and my hormones were high, it was likely, probably there before, but it was, just going to stay small and grow at a slow rate. But that pregnancy, the hormones lit it on fire and it went everywhere. And to your point, I think for me, the experience has been similar in the sense that I felt completely fine before. And then, post getting diagnosed, like I unfortunately, like I would say, I feel worse than I've ever felt before. And, it's just like, it sucks because I think for some people, they do have this experience of they're feeling bad and then they go find out that they have cancer and then maybe they do feel better afterwards. But I think for a lot of us, we don't have that experience. We're fine. And then all of a sudden, one day you're not, and you have to get treatments, and then you feel like a shell of a version of yourself. So I really want to thank you so much for sharing that story with us. I know it's really not easy to relive it. And so I really appreciate you doing that. I would love to ask you, so like you went from this really intense experience. How did you go from that to creating the Cancer Freedom Program? Because I mean,
Yeah.
you talk about making lemonade out of lemons. Like this is such a version of that. So I'd love to hear that
Yeah.
story.
So I've spent every aspect of my career trying to place myself where people are in the most need. Um, that's like really what I've strived for. So I started working in cancer care, and I really can't tell you exactly why I picked oncology. I just like was drawn to that area. I didn't really have a ton of exposure personally to cancer, and but I was just drawn to that area, and so I started working in that field, and I loved it. Like the drugs are constantly changing. So for someone that's really intellectual, that's always stimulating. Um, and the people you work with are the best. They're the best. They're the people that are going through some of the hardest periods of their lives, and they are kind and they are living,
Right.
as opposed to other patient groups or other client groups. Like people with cancer, they are amazing humans. So I just really loved it. And then when I was personally diagnosed, I was like, ah, this is why I've gravitated to this area. There was really like a higher force or power that pushed me in this direction. And so I just felt really, I currently feel really blessed to have like this 360-degree experience.
Right.
Like I have the research, I have the clinical aspect, and now I have the patient aspect.
Right.
And there were things that I said to people before I was diagnosed that I like cringe thinking about now. Like, not they were wrong or hurtful or anything. It's just that it lacked practicality.
Yeah. Are there
like,
any examples that you can remember?
oh, yes, like cancer exhaustion is the number one side effect. We know that's the most common side effect that women navigate. And a way to alleviate cancer exhaustion is actually through exercise. Okay.
Right.
But when you say that to someone who's exhausted, who can barely get out of their bed, oh man, if someone would have said that to me, I would have been like, okay, like you
Yeah.
don't know what you're talking
You
about.
don't get it.
No, you don't get it. You don't get it.
Yeah.
Like, I'm not going to go to a spin class.
Right. Yeah.
Okay. So now my approach, although like the literature is really clear, but like, hey, look, let's fix your exhaustion with your nutrition first, get you more energy through fueling you correctly. Then let's start talking about not even exercise, but movement.
Hmm.
Let's start with that.
Yes.
And then we'll take it to exercise. So I think at this point, I'm just really blessed to have like a more practical and well-rounded as well as academic
Yeah.
view of this. Now, when I finished my treatment, there was no one that helped you with recovering from the side effects, so getting to side effect free and staying cancer free.
Right.
Okay, so there's a difference. Your oncology team is going to help you get to cancer free, period. That's the end. That's like, and thank God they're so brilliant at that.
Right.
But that's the end of the road for them.
Yeah.
You know, they're like, hey, look, go live your life, go live a healthy life, enjoy. We'll scan you.
Right.
But scans don't stop cancer from returning,
Right.
they monitor for it.
Correct.
So you're left to just be like, cross your fingers. That blows my mind
Yeah.
because we have such clear guidance that there are strategic things you can do to lower your risk of recurrence. The literature's really, really clear.
Right.
Okay.
Right.
And we all know, like, we know smoking. We know smoking, if you stop, that will lower your risk. There are other things aside from smoking that you can do. Right.
Yeah.
And so the fact that when I finished, there was no guidance. There was no guidance at all. And it just it was just mind boggling, and it's still mind boggling that there's really no guidance. So if I was to truly be the person that always went to the place where they were most needed, then it's not helping women during treatment, it's helping women after treatment.
Right.
So that's where I shifted my entire practice. 8 7 8 years ago now. I've been working in cancer care for 14 years, but the latter 7 have been dedicated to recovery and remission.
Right.
And so that's when I started focusing my energy on creating the best strategies and the best plans, not only for myself, but for other women around me so that they could fully recover as well.
Yeah. Absolutely. No, I think there is unfortunately like it feels a little bit lacking, right? So with oncology, you kind of expect your oncologist to be like, okay, so here are things that you can do for diet, nutrition, exercise, movement. But that's not what they went to school for. That's not what they do their research in. Their focus is to get rid of your cancer, or if it's metastatic, to help you, live as long as possible and manage your
Exactly.
your treatment there. But it is not, they just don't give guidance on anything else. And so I think what you're doing really is like there's such a gap there. And, from what I've seen on your program, like it really is, it should really just be like a common thing that, you get discharged from oncology and you get paired with you, for example. Like this is like
Yes.
the route that people should go on.
Yes. Absolutely. But like it's so easy to say like, look, my oncologist should have told me. They should have helped me with this. At the end of the day, I've yet to hear of an oncologist do that. Okay. So if your oncologist didn't, I don't think that there's anything wrong with them. I don't think there's anything wrong with mine
Right.
because they can't be like jacks of all trades
No,
here.
no.
Right. Otherwise they lose their brilliance in that niche area. And we don't want that.
Right.
But it does become, although it's like not your fault, right? It's not your fault you were diagnosed with cancer. It's not your fault any of this happened, but it is your responsibility now to find the path out of this completely,
Yes.
right?
Yes.
And whether it's stabilizing disease, but also living your best and healthiest life while you do that, like that's your responsibility now.
Yeah, absolutely. Okay, so maybe you can tell us a little bit about like more in detail about like what the Cancer Freedom Program really is all about, and like how are you, you mentioned things like nutrition and diet and exercise. Like what do you focus on and how do you help someone kind of reclaim their life after cancer?
Yeah, so when you work with me, we start with three core pillars. So we've got to focus on the three core pillars of remission and recovery first. Okay. But what I do first before we ever really make any changes is I've got to do a cancer remission audit. So I've got to see, like, why are you still having these side effects? Why did you have cancer in the first place? Right? Like, what were the risk factors? And we're never going to get like, oh, you had mold in your house. That's why you got breast cancer. Like, that's not the type of answer we're going to get. And
Right.
if someone tries to tell you that answer, they're lying,
Right.
right? Because we know this is like multifaceted. But
Right.
that's where I want to start. Is like, where are you at right now? So let's do an audit. And there's probably a lot of good things you're doing, right? Because you clearly care about your health, but obviously there's holes. Okay. So let's find where those opportunities for change are and focus on there. Okay. The first thing that I'm going to correct is your food. Okay. Now, a lot of women come to me and say, like, look, I'm good with my food. I eat healthy. 80% of the time I'm eating, healthy. 20% we're having fun, but I do good.
Yeah.
I totally hear you. But healthy before cancer should be drastically different than healthy after cancer. There's different types of healthy here. Okay. So although you're eating healthy, it's got to shift after you've had these traumatic things done to your body. You've
Right.
had surgery and chemo and radiation. Your nutrition needs to be aligned with that recovery. It can't just be like the chicken salad you had for lunch for the last 25 years,
Right.
right?
Yeah.
So we've got to shift it. So I'm always going to start there. The reason why is because this is where I get the most rapid change in your side effects.
Got it.
If you have cancer exhaustion and I change your nutrition, your energy is going to come back in 3 weeks,
Wow.
21 days.
Wow.
It is so fast, Bisma, because I've done it so many times
Right.
that I'm like, gosh, that seems fast. But I'm like, I've done it so many times that I'm like, yeah, it's 21 days. Give me 3 weeks, your energy's back.
That's
Okay.
amazing. It sounds like you've like found the formula.
Absolutely. Like it's
Yeah.
really not that complex what once we identify the area in your audit and then make the change.
Right.
Okay. It's not like this lifelong journey you have to go through.
Right.
Okay. So I'm always going to start with nutrition because you're just going to feel better.
Yeah. And that really
Okay.
is like the first, starting point. It's like without that piece, probably can't do steps 2, 3, and 4.
Yeah. I think so many women are like, what supplement should I take? Right.
Yeah.
And I hear you because that would be easy, right? Like Amazon.com, like vitamin B12, to cart, take it, right?
Yeah.
It's just supplements are designed to supplement, right?
Exactly.
Like
I say that
supplement
all the
your
time.
food. Yeah. Yeah. So, like, we need to fix your food. Otherwise, we're supplementing something that's broken.
Yeah.
Okay. And so I get it. Like, I know it's easier just to do that, but we've got to do the hard work for the long lasting results.
Yeah.
Yeah.
I'm curious. So do you recommend like a vegan or like a plant forward diet? Like what are some of the like the guiding tenets there?
Yeah, for sure. So first things first, it's got to be something that aligns to you. Okay. So if I'm not going to tell you, hey, I need you to eat shrimp every night for supper, and you're like, wait a second, I'm actually like allergic or I hate it,
Yeah.
that's not going to work. So women that come to me, they might be vegan, they might be vegetarian, they might culturally have different types of foods they love to eat. We're going to align with that because we're talking lifelong here.
Right.
Okay. Now, you do not need to go vegan or vegetarian. The literature is really clear on that. There's lots of cancer influencers that will say, like, you need to eat a raw vegan diet, you need to go keto, you need to. I would rather you follow a diet that's been proven over decades to work rather than like the latest fad.
Yes.
So the diet that I'm going to start with is I'm going to look on macro level as to the proper fuel for you specifically. So for Bisma specifically,
Got
right?
it.
For Sarah specifically,
Right.
right? So every woman that works with me is going to get something customized for her body and her diagnosis, right? And so I'm going to start macro level. So I'm going to look total calories, protein, carbs, fat. Then we're going to go micronutrients, fiber, sugar, vitamin D, calcium, iron. Like we're going to go more micro into that. And that's how I really guide nutrition wise.
Great. And I think that's really important to make it tailored to the person because yeah, you could just give someone a document that says you need to eat, X, Y, and Z, but if that doesn't align with, what they want to do or what they're able to do, then really it's just a pointless exercise. It's not
And it's
something that
also,
they'll maintain.
yes, absolutely. And
Yeah.
it's also about like the quantity in which you're eating specific foods. So many cancer survivors get like a list of left hand side, eat this, right hand side, do not eat this. Like, gee
Right.
whiz, thanks. That's not helpful because there's a difference between eating a quarter of a cup of rice and 2 cups of rice. right? That's different. Okay. So we need to make sure you're eating the right quantity for your body and for your diagnosis of the right foods.
Right.
So it needs to be in more depth if you truly want to get the fastest recovery and give yourself the best shot at staying cancer free.
Yeah. And so do you tailor it to like the type of cancer they've had and like the specific side effects that they're experiencing?
100%. 100%. Like everything's driven. We hold a few core values when we work together. Okay. So the first is going to be sisterhood always. Okay.
Love that.
I try to be, I'm a big sister in real life. In real life, like this is pretend life, but no, I'm a big sister actually, but I try to emulate that energy, right? I'm going to tell you the truth. It's going to be from a place of love, and it's not always going to be what you want to hear, but it's going to help you get there. Okay. That's like the energy we bring. And then once you join our sisterhood, you're in it for life. Like you are here for life. You can't get rid of me. I'm always going to be there to take care of you. Okay.
Right.
So that's number one. The second thing we hold is results. Okay. We are here to achieve results. The women I work with are like high achievers, right? They're lawyers, they're docs, they're VPs, they own their own businesses, they're stay-at-home moms, like they are excelling.
Right.
So we hold results really dear. So, in order for me to get those fast results for you, I've got to customize it to your diagnosis.
Right.
So, whether you have hormonally driven cancer or not, the stage of your cancer, the main side effects that you specifically had, we are going to get rid of that side effect the first. That's the first thing we're going to do.
Yeah.
If you don't have hot flashes, I'm not going to talk to you about hot flashes. We're going to talk about exhaustion,
Right.
right? Like
Right.
whatever's tailored to you.
Yeah. What about pain? Is pain something that you can address through nutrition?
We get a
Got it.
lot of women that reach out to work with me because of joint pain from their anti-hormonal drugs or just from their chemo,
Yeah.
right? They just feel achy in their
Yes.
bodies. And so absolutely that's something we focus on.
Yeah. No, I've definitely noticed that. I always joke like so I'm 37 years old now. But I feel like when I like get up from a chair, like I do what like people in their 70s do, like where I just have to stand for a moment because my joints are so stiff that I can't just immediately get up and start moving. I need to like pause and
Yeah.
I think to your point, it's like, there's certain movement and exercise that have, if I do them consistently, they do help with that stiffness. But,
Yes.
it's
Yes.
not like what it used to be, which is like me going to a soul cycle class. Like that's just not going to be the right thing for me right now.
Look, so we're around the same age. I just turned 38. So
Yeah.
I love Peloton. Like we have a Peloton here. I
Yes.
love like going to a spin studio. I love that energy. I love the high intensity. I love it. After
Yep.
cancer, I did that. That is the worst thing you can do. That high intensity exercise just is so hard on your joints and it worsens your hot flashes.
Yeah.
It's not going to help you lose weight if your hormones are being suppressed. Now, look, if you want to get back to the soul cycle, 100% we're going to get you back there because that's what you love, but just not right now. Just not right
Exactly.
now.
Exactly. You talked about nutrition. You talked about, exercise, movement. What are some other aspects that you like to focus on?
Yeah. So we talked about the three pillars. So we focus nutrition first, then we're going to go targeted exercise. So the reason why I do targeted exercise next is because now you're feeling better that I've corrected your nutrition. But we can start with strategic movement, targeted exercise, and that's what's really going to lower your risk of cancer progression or cancer recurrence.
Mm.
Okay. We know, and this is from decades now, like decades of research, tens of thousands of women with cancer. We know that if you hit target exercise levels, you lower your risk of a cancer recurrence by 59%.
Wow.
Right. A 59% reduction in risk of recurrence. This is like better than a lot of drugs on the market here. Okay. And this is not being utilized. We had a publication that came out less than a year ago that looked at the percentage of cancer survivors that hit four anti cancer lifestyle strategies. And one of those strategies was exercise. Now, this research looked at if you exercised within the last 30 days, okay? that is a low bar. That's a low bar, right? Like if you went on a walk in the last 30 days,
Yeah.
only 4% of cancer survivors.
Wow.
Okay. So we have a tool that you can use to cut your risk by more than half, and we're not using it, right? And this is where I hear women say, like, look, I'm exhausted. Like, how are you? Right. And so, absolutely, let's start with your nutrition, get your energy back. Then we're going to start really simple to get you up to those target levels to get that risk reduction that you want so badly so you can be here with your family. Okay. So that's targeted exercise. And then the third thing that we have got to do that is totally ignored by almost everyone is mindset.
Mm.
You've got to heal physically, but you've got to heal mentally too, sister.
Yeah.
Like this trauma that you've gone through, whether you want to label that or as trauma or not, you've got to unpack it, and you've got to release the cancer patient identity that you've had to take on, like no fault of your own.
Right.
But we've got to release it. Otherwise, we're not truly free from cancer then.
Yeah. That's so important. I think that's also that's an aspect that unfortunately isn't talked about too much. People do talk about mental health, but they don't necessarily talk about the mindset shift and what that entails.
Yeah.
What are some like activities or methods that you use or encourage people to do? Is it like meditation? Is it journaling? What type of
Yeah.
items?
Yeah, absolutely. This is my favorite. Okay. And when you work with me, you get access to my mindset experts as well. And this is what I learned from one of my mindset coaches. Okay. That works with me. So she uses a technique called the flip it technique. Okay. So let me explain. So many of us as cancer survivors, especially as we're approaching follow up scans, we think, what if my cancer comes back? Right? Like, what if it's spread? What if the drugs aren't working? What if it's in my spine? Right? So,
Mhm.
like, what if it comes back? Right? And her technique is to flip it. So, if it's possible that your cancer comes back, if that's a possibility, then the opposite would also be a possibility. Like, that's just realistic, right?
Yeah.
So, what if your cancer comes back? Then just pay attention to how your body feels. Like when you say that, what if my cancer comes back? Right?
Hmm.
Now say, what if my cancer never comes back? And now feel the different sensation in your body.
Right.
Okay. Because logically, if one's possible, the other's possible too. So every time you think, what if, then just try the other.
So even just hearing you say that when you said, what if my cancer has come back or what if it's progressed? My body immediately tensed up. I felt just
Mhm.
like this tightness come over my entire body. And when you said, what if my cancer hasn't come back or it hasn't gotten worse? I felt joy and elation. And so just even that
Yeah.
simple exercise that you just did, I mean, I totally felt a difference in there.
Yeah. You just feel lighter, right? You feel
Yeah.
lighter. And so I mean, that's only logical, right? And I always think every woman that works with me is brilliant and they're well researched and they're intelligent. And this is logical.
Absolutely. Okay, so you work a lot with patients that are post treatment. Do you also work with patients that have metastatic disease?
Yeah, absolutely. Some of my most successful clients have metastatic disease. Because look, like a lot of people, I think, have this misconception that most of the time, if you have metastatic disease, it's because like the drug stops working, right? Like and that's definitely possible. But what's more common is that your body can't tolerate the drug anymore, right? Like we
Right.
see elevated liver enzymes or your renal function or you get peripheral neuropathy. So we have to support your body in tolerating that drug. That's what's going to allow you to stay on treatment for longer
Right.
and to live a long, healthy life. So the metastatic thrivers that I work with, they are constantly supporting their bodies to be side effect free and to stay on them for longer. Um, and that's exactly what they achieve. Like, because look, whether you physically have cancer in your body or not, I don't really care, right? I want you to live like this really full, healthy version of your life for as long as possible. And women with stage 1, stage 0 cancer, they could be just as impacted or traumatized even more if they do not put these strategies into place, right?
Yeah. Yeah.
And so as stage 4 survivors, like, gosh, like, the world is yours, like, you can open up the door and really feel amazing even on these treatments.
Yeah. No, I totally agree. I mean, I'll speak for myself. I think,
Mhm,
metastatic patients, like I think we have this different version of reality, and it's tough for us because it often feels like there's no end in sight. And
mhm.
that is sadly like the nature of stage 4. Like there's not quote unquote a cure, and you're never going to be done with treatments. You're always going to be on some sort of treatment. Um but I think, what you're talking about, like mindset coaching, I think that could be so helpful in shifting that narrative of like, yes, I have cancer, but like I'm living a healthy life and I'm feeling good. And so, yes, like you may have it, but if you're not feeling symptoms and side effects, it's just there and you can kind of maybe learn to, tune it out essentially.
Yeah, I mean, I'm always gonna be an optimist. I think that's just in my nature. I just really feel like there's a lot of beautiful life to live even after a stage 4 diagnosis. And if you're not like fully embracing that because you're so held back by either mentally or which is understandable, or your treatment, also understandable.
Right.
But then, like, what's the point of any of this,
Yeah.
Like, if we're living as a shadow version of ourselves, then, like, why? Like, what do you got to lose, right?
Yeah. I always say there's a difference between being alive and living. And like you can be alive, you can be here on this earth, but if you're not actually living and thriving and embracing life and enjoying it, then what are you really doing? You mentioned a little bit about weight gain. I know I've had many conversations around this. I think people, from the outside typically think like cancer, weight loss,
Mhm.
like you're going to be like this frail version of yourself. That's, I'm sure you've seen in your work, it's not the case, right? A lot of women gain a lot of weight because of these hormonal changes that they undergo. Um how have you seen amongst your community like shifting that mindset or like giving yourself grace because like there has been this weight gain aspect?
Gosh, yeah. Like, when I went through treatment, I gained 20 pounds. Um, and like, it just kind of like happened. Like, I knew I was perimenopausal, especially after I removed one of my ovaries. I went through chemo. Like, I was perimenopausal for sure. But this weight gain, this belly fat, this uncomfortable in your body, that it was rough. And I really don't, there's so many factors that contribute. You know? Like, it's hard enough to maintain a healthy body weight in North America, like, in our culture, really. We know that just in general, but then you get, like, surgery restrictions and stress eating and steroids and anti-hormone, like, lordy, okay? But here's the other side of this, and I come back to, like, taking responsibility as well, even though it's, like, not easy and it's not right. We know that one of the things you can do to lower your risk of progression or recurrence is to stay at a healthy body weight. So for me personally, I was like, look, I know I'm up to 20 pounds and I know this is not good. For an ovarian cancer survivor that has such a high risk of recurrence, I was like, look, I've got to change this. So I think there needs to be a balance here between, like, yes, acceptance and then this happened and it's not right. But whenever someone is ready to trend towards whatever they define as their healthy body weight, I don't typically set that for someone. I think that's where you feel comfortable in your skin. Like, you tell me what that is. Whenever they're ready to trend towards that, then we need a strategy to help you drop that weight that's specific to your body now. Okay. Like,
Right.
because what we did in our 20s to lose weight before cancer, before our hormones were messed up, that's not going to work. That's not going to work
No.
anymore. Right. So you need a strategy now. And it's often very different than what's worked before.
Yeah. No, I think that's so important. I think a lot of us go back to like are like tried and true methods of weight loss that we
Yeah,
used to use in our 20s. And it just, I think with age in general that doesn't work, but especially when your body pre-cancer and post-cancer are two different bodies. And
absolutely.
so
And
you have to do something different.
like the troubling part of this is like, think about like how long it took you to figure out your body as like an adult woman, right?
Mhm.
Like what it needed and how you felt your best. It's like you probably never achieved something where you're like, I've got to figure it out, right? You're probably still like working on it, figuring it out. Then you're diagnosed with cancer. So literally the rug's pulled out from underneath you. I just don't want you to have to spend decades more to try to figure out this new body, right? Because like you do need to figure out this new body. It's totally different.
Yeah, absolutely. Um this is all really great. This is so helpful. Honestly, even for me, like this is, these are things that you think that but I think it's different when you're talking to someone who does this day in, day out and works with thousands of patients and you've seen it again and again and you've seen what works, what doesn't work. And I think that's really just so helpful. So, for someone who's listening in and feels overwhelmed by like all of the conflicting information about, what everything that's out there about like what to eat, what to avoid, how to exercise, what types of exercises are okay and not okay, what do you think is the first step that they could take? And even just something they could like do today to maybe like start getting on the right path.
Yeah. Yes. Okay. So I have two thoughts on this. The first is this overwhelming amount of conflicting information. Okay. When you have so many external voices talking to you all the time, like we do on social media, right? Constant, right? You wake up in the morning, you're scrolling before you go to bed at night, you're on Facebook and TikTok and Instagram and YouTube. Like there's so much, but when you have so many external voices, you can't hear your own internal voice. You can't hear your own intuition. So what I really encourage women to do is find like true experts in the area, okay? People that actually have some formal training, okay? Not to discredit like the cancer patient experience at all. Like I went through that and I've said like that was invaluable to me, but that's not what allowed me to help women with all different types of cancers. Okay? I hear a lot of people following, a man diagnosed with cancer and I'm going to eat the same as him. I'm like, you have hormonally driven cancer. Like you cannot do the same thing a dude is doing. Do not do that, right? So
Totally.
what has allowed me to help so many different types of cancers is my formal training. It's not necessarily my patient experience. So I would find someone with formal training in whatever area you're looking at. Find someone you trust, like someone that you really like their personality, and then follow like two people, like two experts. Unfollow the rest. You are not going to miss anything. Like you're not missing something important if you're not on cancer influence or YXC's supplement regime. Like you're not missing anything. It's causing you more anxiety and fear at this point, right? So I would just tunnel vision in on the people you trust, and that's it. Okay.
Yeah.
And that's what I personally do as well. Like in other realms of my life, I really don't follow people unless I like truly trust them and they have something to back it up.
Yeah.
Okay. And so that's where I would start. Now, the thing that you should start doing today, like without a doubt, okay, because I would say 98% of women that come to me, they're not eating enough protein. You need essential amino acids for your body to heal and recover after treatment, and amino acids are the building blocks of protein. So if you're not eating enough protein in your diet, your recovery is being delayed. That's fact.
Got it.
Okay. So whatever that looks like for you. So now when we typically think about protein, we are thinking like steak, chicken, tuna, okay? But there are seafood like whitefish, there's we already talked about shrimp, scallops,
Mhm.
there's dairy, like cottage cheese, Greek yogurt, there's vegan, there's nutritional yeast, seitan, black beans, lentils, like bump up this food.
Yeah. Is there I'm guessing it varies, like the protein target per person, or is there like at
Yes.
least like a minimum that you think like people across the board should at least be trying to hit?
Yeah, you're absolutely right on that. That it varies by the person for
Okay.
sure. There's lots of apps online that will help you calculate a protein target. Cancer survivors should not use those apps because they're not meant for cancer survivors. So the
Okay.
protein target it gives you is going to give you a target for someone that never had these treatments, that never had this diagnosis, that their hormones are totally fine. So it's like totally inappropriate. So instead of focusing on a number, what I would do just to start is just increase it because
Okay.
I bet you're going to need to increase it.
Okay, that makes a lot of sense.
Yeah.
I just really love how your approach is, it's science backed, but you also have a personal experience to it. So I think it's like such a good combination, and I think it's actually rare. You kind of see people on one side or the other. You have the patient experience, but that's a very narrow view of one person's experience with one type of cancer. And then, as we talked about, we have like oncologists who aren't really weighing in on this aspect of it. So I think, the work that you're doing is amazing. What's kind of been like the most rewarding part of this journey for you, either, as a survivor and now as a coach?
Oh gosh, it's an absolute honor every single day to help women like not only recover from cancer, but like get to share their unique gifts with the world. Like I truly feel like as we get rid of these side effects, as you get rid of the fear, the exhaustion, the joint pain, the weight gain, you come back to life and you get to share your gifts, whatever that is. And it makes like our entire world better because you're able to share your true self. It I always say like I have the best job in the world. This is it. It's mine. When anyone is like, "No, my job's good," I'm like, "No, it's not. It's not as good as mine." Because it's like it's totally purpose driven. It's just such an honor.
Yeah, that's wonderful. Thank you so much, Dr. Amy, for joining us today and for all this incredible work that you're doing. For anyone who wants to learn more about the Cancer Freedom Program, where can they find you?
Yeah, just go to cancerfreedomprogram.com or you can find me on Instagram, YouTube, Dr. Amy Cancer Recovery.
Perfect. Thank you again, and thank you to everyone listening. Thanks for listening to The Other C Word, hosted by Bismolology. New episodes drop Mondays. Connect with me on socials at Bismolology, and let's all learn, grow, and inspire each other.